At Shalom Makleke, you remember we have some of the specific wards that are designed for people with medical aids.
Correct.
We're improving all the hospitals, even myself. I no longer, because I have a problem of my eyes, but I go to Parakwanath using my medical aid to pay for my eyes. So opening specific areas and specific wards in our hospitals. And we are saying to them, don't clean the hospital, keep the hospital clean so that we maintain that. So our maintenance now, we've strengthened it. We have a Department of Infrastructure that have been not working properly with the DID, because we have Department of Infrastructure again that is assisting on the other side as our agency.
Your mornings with Malume Tap.
MEC, good morning.
Morning, sir. How are you?
Very well, thanks for taking time out of your day. And I was very worried when I wore my Orlando Pirates shirt this morning. I'm like, either the MEC is going to love me or going to hate me, but I hear you are a fellow Pirates fan.
I love it. Every time when Pirates play, I stop everything.
Okay, fantastic. We're going to get off to a good start. MEC, we've got a lot to talk about, but let's start with the turnaround. How's the turnaround project coming? Are patients having a better experience at the province's public health care facilities?
We've really turned things around in the hospitals and in the clinics in the province. It has not been easy because, as you have indicated earlier on, that it is one of the areas that have been very difficult, that have regressed. And I think I can confidently say now we have improved our services, and we've been receiving a number of compliments now instead of complaints, because people are happy with what we've been doing. In fact, we even have our third quarterly report, if you can read in this financial year. It's one of the better reports now, because we have made sure that at least quite a number of things I have improved, whether is it in infrastructure, patients' care, and including the part that we always forget about, it, which is stakeholder engagement and partnerships with some of those stakeholders that must assist us.
One of the things that I wanted to compliment you and your team on as well is a campaign that you recently launched. Very interesting campaign called Serve with a Smile. Take me through the idea and what was the impact that it was designed to have?
Serve with a Smile campaign, it's really helping us because we're teasing out the Batupili principles, because it's an effort now to address the staff attitude that has been there in our institutions, and we're boosting the morale again of our staff. And I think healthcare workers, all of them now, they are part of this campaign. We've launched it to all the hospitals, to all the clinics. As we speak, day before yesterday, I was in Far East where they were relaunching it again. It's part of the activities, including the well-being of themselves as the staff. So it's very good, that campaign, and people are appreciating it. We do serve with a smile. Patients are happy, and it seeks to mobilize healthcare workers to pledge to serve all the patients in the hospital.
And I say this because it's an initiative and a campaign that's close to my heart, because a hospital can be a scary place to be as a patient. And I think it's one of those places where if the healthcare workers are having that smile on their face when the nurse or when the doctor comes in, it kind of gives the family of the person who's in hospital hope. It gives that person hope. So I commend you and the department on that campaign. I think it's fantastic. I know Jose Khadi's got a question for you as well.
Yes, MEC, I would love for us to touch on the NHI, right? Those opposing the NHI claim that medical aid will become useless once it is in place. Is that the case?
No, it's not the case. In fact, we are putting up systems that even those that are using medical aid, they will be able to come to those hospitals and be serviced. At Shalom Makleke, you remember we have some of the specific wards that are designed for people with medical aids.
Correct.
We're improving all the hospitals, even myself. I no longer, because I have a problem of my eyes, but I go to Parakwanath using my medical aid to pay for my eyes. So we're designing those systems. It won't be useless. Instead, we're going to improve those services so that if you feel that this is what you need to do, you will definitely go there, because we have the best specialists in our hospitals. The other thing that we have done is to check what other countries are doing.
Sure.
If you can go to Dubai, because where they have academic hospitals like your Chris Ani Parakwanath, Charlotte Makleke, Steve Biko,
Biko,
Dr. George Mukari, the four of them, we will make sure that, including the tertiary hospitals, in every hospital, including our regional hospitals, we'll design, there must be specific wards that when you feel that you want to go there with your medical aid, you must go there and stay comfortable. We can even do your work in those wards and the treatment you'll be getting in the hospital. So that's how now we're trying to improve our systems in the hospitals. But everyone with or without medical aid, you will get assistance once you get there. Even now, we do allow you to pay with your medical aid.
I do love that, and it gives a certain credibility to these, to the hospitals, and shows how efficient the wards and the hospitals and the staff are. I wanted to ask you, MEC, how ready is Gauteng for the implementation of NHI?
We are ready because we have a team. In fact, Chief Director that is here now, he's responsible for communication of every decision that we have done.
Yes.
We have teased NHI. We're trying to educate communities now through our local health promotion programs. Even on Sunday, I will be in Tshwane addressing the citizens around there, because now we're grouping people. We're going to specific sectors, address them about the implications of NHI and the expectations thereof, and what is it that as a department we will be doing once we start rolling it out, the implementation of NHI. But I can proudly say confidently, so again, we are ready for NHI in the province. We are improving even our facilities, because that's one of the areas, again, that our infrastructure must be at the level of a private hospital, because you can't leave a better hospital and then you go to a shabby hospital.
Yes.
So those are the things that we have done, and I know you have been following me. We're opening specific areas and specific wards in our hospitals, and we're saying to them, don't clean the hospital, keep the hospital clean, so that we maintain that. So our maintenance now, we've strengthened it. We have a Department of Infrastructure that have been not working properly with the DIT, because we have Department of Infrastructure again that is assisting on the other side as our agency. But now our team, even internally, it's very strong now. I can say that they are able to improve the specific areas. Like, for example, one person was saying to me, I've been going to this clinic, there was not even a light in the clinic. You can't take ages to fix a light.
No.
So you can't take ages just to fix a handle in a ward or in a theater. So those are the things that we've improved. If you can go now to our all hospitals, we have a program that we have done on the 18th of Mandela, I'm sure because you follow me, on surgical backlog.
Yes.
That program forced us to improve all our theaters in all the hospitals. They are working. Where I know there will be a problem, it will be just minor problem that we are fixing it in specific hospitals. But again, that program helped, because there were people that were in the waiting list for ages, and the surgical backlog that we've started on the 18th of July under the name of Tata Nelson Mandela. I can confidently say again, next week I will be telling you that from 37,000 of the people that were on the waiting list, we are done with that on that surgical backlog.
Wow,
now
fantastic.
we'll only be having people that are on the line, like you and me, that we have been here. Then they said you must come next week. But when it comes to surgical backlog, we've done all those. And that's part of the improvements, again, that I've said. We can't say we're ready for NHI if we still a surgical backlog that is sitting at 37,000. Hence, we had to push and make it a project. Then we're done with it now.
Before we close the interview, I wanted to ask this right now. MEC, we know that you are very much a fan of jogging and other physical activities. I wanted to find out, is it a requirement from the Premier that you must train or that you are in good health as an MEC? Do you need a gym membership? How does it work?
I can see that photo. There's a photo here that you keep on showing it. On the first month that I was in that department, I can say I was happily employed there with those chubby cheeks, everything. And there's a different photo again that we have put in, which is better off now. So it's not a requirement, but it's something that must be within you.
Yes.
Health and wellness, it's part of the Department of Health. We've launched a program called Wellness Wednesdays. Everybody, we want you in your techies, in your jeans, in your tracksuits at work, so that you can do some exercises. You move around with the stairs. So it's just encouraging some of our and our workers. And I even say, when patients are sitting in a queue, there must be somebody, which is the quality assurer, that must come to them and tell them just do exercises even in the clinic. And it's so exciting. It's very good. We love it. All our hospitals now are having Health and Wellness Wednesdays.
Wow.
And they are doing it. It's a must that you do it. Part of my reports, when I get on Monday, I want to know which hospital is not doing Wellness Wednesdays. So including myself, I'm there.
Sure.
We're doing 2-kilometer hikings over the weekends. We're partnering with stakeholders, and everybody is excited about this program, because it removes even the stress within us as public sector workers, because sometimes you get irritated because of your frustrations that you have of the the burden that is on your shoulders. But if you do these Wellness Wednesdays, there's that excitement, but there's interaction, but there's another bond that you create between the staff members.
And I mean, that's the definition of leadership, leading from the front, showing your patients that you take wellness and health seriously. So I commend the department and yourself for that initiative as well. We've got time for one last question.
Yeah.
Khosi?
Unfortunately, MEC, your term is coming to an end in May. Would you say that your mandate has been fulfilled? What do you have to say?
My mandate has been fulfilled. I can even give you my report of the elevated priorities
it.
that Premier said I must do. When I started, they were all red. Now I'm at green, all the elevated priorities. But I keep on moving because we want to finish strong. There are other things that we need to do because now at forensic, you didn't know that forensic is part of the unit of my department. The forensic now is having a backlog on toxicology because we're working with the police. But now we have again a project that we have just launched last week that we're going to reduce the backlog at forensic, especially on toxicology. So those are the things that we want to do. In fact, it's exciting for me that we've moved within 16 months that I've been in the office. We've moved that department to where it is now. You remember we had a problem even of finances in the department. We're unable to pay service providers. We do pay them now. We do arrange when we have some problems. And some of the amounts that we're paying, like the telecom issue that recently come on board, it's an amount that we've been owing since 2003. So it's some of them, including the litigations that people are talking about. The amounts that we're paying, it's the backlog that is coming as early as 2013. So 2006, 2013. So it's all those years. But now we've set up systems, we have processes in place, and I'm proud to say we will finish strong.
MEC, thank you so much for joining us. We will put this up. If you've only just jumped on your radio and you've missed out on it, we'll put it up on the UConnect app as a podcast. You'll be able to listen back to it and not miss out on any of the important details. But that was us closing off the show, hanging out with Gauteng Health MEC Nomantu Nkomo Ralehoko. Thank you very much, MEC, and we look forward to seeing you again in the future.
Thank you so much for having me at 89.8. I really appreciate it.
You're always welcome.